CKD or PKD from an early age, there is a link but very susceptible to uremic toxic load. So there's like a
oxidation reduction system and so many things.
Hi everybody, and welcome to the Kidney Coach YouTube channel. I am naturopathic Dr. Fiona Chin, co-founder of Kidney Disease Solution, Kidney Coach, and our flagship products from Kygenesis. And I'm joined again today by one of my favorite guests, Dr. Alexander Grinberg. Dr. Grinberg is hello. I'm always so glad when you join me. Dr. Grinberg is a practicing physician up there in San Francisco in the US, working with patients in the area of longevity, lifespan, extension, personalized anti-aging, nutritional optimization, lifestyle medicine. So very, very holistic in what he does. He's not only a practicing MD, but he's also got a background in virology. He's also got psychiatry background. He started his medical degree when he was 16, which is just crazy for me. So he's been doing, this is what he's dedicated his life to. In fact, Alex, I think we'd spoken about that you became almost obsessed with longevity and anti-aging from like the age of like 6 or something. So you've really, this has been your life work. Let's dig into what happens in menopause. What is that process that as women joyfully get to go through, and what happens in that? And then walk me through potentially the connection to chronic kidney disease from there.
So I'll briefly give some formal definition, formal knowledge, and we can proceed to very exciting things that can hopefully benefit everyone. So formally menopause means the 12 months, absence of periods for 12 months, and a raise of the levels of FSH, follicle stimulating hormone. This is basic medical definition of menopause.
And so pregnancy, is there an increased risk of
actually
I'm just thinking, yeah.
Should be mentioned that we will discuss few different situations like pregnancy, kidney transplant, and dialysis as well, because they all involved and they kind of try to reflect on all aspects of the problem. So obviously CKD frequently makes it more difficult for women suffering from this condition to get pregnant, as they may frequently suffer from young age from anovulatory cycles, from amenorrhea, dysmenorrhea, and also may have some urogenital conditions that may create difficulties in sex life and getting pregnant. And
so you're just saying if you've got CKD or PKD from an early age, there is a link between a faulty or dysfunction in the menstrual cycle.
Yes, and the hypothesis is that uremic factors even that are more than average, they endotoxins and sexual glands cells are very sensitive to toxins. And
fascinating. Okay, so that's a uremic toxic pathway, and then you've got your receptor sites in sex hormone glands that are very susceptible to uremic toxic load. So there's like a toxicity accumulation that occurs in the sex glands, hence changes to hormone production. I hadn't heard that before. That's fascinating. So sorry, keep going. I'm just wrapping my head around that. It's amazing.
Like it wasn't bad enough. Also, women who suffer from CKD from young age, their blood vessels are also more fragile, and they either by uremic toxins or by reactive nitrogen or oxygen species that also don't get eliminated well, because uremic influence affects also glutathione system and oxidation reduction system and so many things. All these systems that without this condition would help to regulate and to bring it to normal, they may be overwhelmed by dealing with what happens in the kidney.
Fascinating. So really, there's such a huge interrelationship between hormones and kidney function that no really talks about, and it was interesting before we hit record, you were saying there's just not a lot of clinical, when you were diving into the studies, there's not a lot of studies done in women and the relationship between changes in women's hormones to chronic disease. So I find this fascinating. So I obviously live and breathe kidneys, and I hadn't realized there was such a close interrelationship between women potentially having anovulation or ovulation failure if they'd had CKD earlier on. So I find that really fascinating. And of course, the uremic toxic link. So pregnancy, and you were going to talk about dialysis and transplant. What were you going to say about those parts?
So continuing on pregnancy, and women with already compromised or predisposed to be compromised lining of endothelial vascular 3 inside the nephrons, they are very susceptible. So that's probably everyone heard the names preeclampsia, eclampsia, when women, when they're pregnant, develop very malignant increase and changes in their blood pressure, and also intracranial changes, and start having seizures. So I believe probably at least part of women prone to have eclamptic changes have undiagnosed or underdiagnosed kidney function. And I would recommend all young women, all women planning to conceive, also have to pay very close attention to their kidney function and to study it well.
Makes sense. Fascinating. Okay.
But I'm sure there are multiple interactions between kidney problems and kidney function and complications of pregnancy. But if we just name this preeclampsia, eclampsia, it would be already good. And obviously, the women with CKD also more prone to have miscarriages.
Right. And what do you think the mechanism behind that is? Is that just the anovulation, ovulation failure, and progesterone level?
Probably many women went through OB/GYN consultations, helping them to make sure they able to carry the pregnancy till normal terms, and they get injections of progesterone. So progesterone is another product of ovary, and if it's suppressed by uremic influence or some other problems related to kidney, it's lack of progesterone. It's one probably of first reasons that comes to mind when you know the physiology. But I'm sure there are other things related to kidney malfunction and aldosterone, renin-angiotensin system that also affects blood vessels between mother and embryo, and also in a poor and very sensitive embryo. This damage for blood vessels for their lining may be fatal and lead to all these terrible things.
Dr. Grinberg, thank you so much. Now, if anyone wants to contact you, infinityepigenetics.com, I'll put the link below. Dr. Grinberg is in San Francisco, but he does telehealth, because I send my really complicated patients in Australia here to him. So wherever you are in the world, he can definitely work with you. Like I say, one of the most knowledgeable people when it comes to peptides. So if I've got any patient where I'm like, they need a complicated peptide protocol, I'm sending them to Dr. Grinberg. So if you want to know more about what we do, please head to www.kidneycoach.com. You'll also find us on Instagram and Facebook under the same bits of information. Remember to hit subscribe and like. That way you'll get notified anytime we put up more information. And if you have questions for Dr. Grinberg, please put them in the comments section below and I will get them to him and answer them for you all. Dr. Grinberg, thank you so much for your knowledge, your time, and your wisdom. This has been a really informative and great podcast, and hopefully we'll answer all those questions that my menopausal women have had when it comes to CKD and kidney disease.